very important MCQ. Well, there is a purpose behind that. If a person is a newly diagnosed case of hypertension, what basic investigation would you do? Up to how much extent you would investigate a patient? Now, a 46-year-old woman comes to the physician for a follow-up examination. She had a blood pressure of this, so she is a newly diagnosed case of hypertension. And she is tall, 5 feet 3 inch, 52 kg weight, BMI is 20 kg, pulse is 88, blood pressure is 150 by 96. Cardiopulmonary examination is normal, examination shows no abnormalities. Extremities are well perfused and strong peripheral pulse. Serum concentration of electrolyte, creatinine, lipid, TSH, plastic glucose, urine analysis is within normal limit. With the following, which of the following is the most appropriate next step in the management of this patient? So, a newly diagnosed case of hypertension, what basic investigation would you do? Well, the answer is you would look for the end organ damage, and for the end organ damage you would do point number 1, ECG. That will show you what left ventricular hypertrophy or coronary artery disease. If there are findings on the ECG, then we will go next. Point number 2, these are the baseline investigation in a newly diagnosed hypertensive in hypertension case, any case. Number 2, RFTs. Number 3, urinary. Number 4, fasting lipid. Number 5, fasting glucose. Number 6, serum electrolyte. Number 7, TSH. Now, if you are having a patient nearby you and there is also the case of hypertension, whether newly diagnosed or old case of hypertension, if there is some investigation missing that I talked about, so you have to do that. So the answer over here will be electrocardiogram. Why electrocardiogram? Because we have to look for the end organ damage. So since hypertension is asymptomatic and insidious disease with severe complication, so an evaluation should be performed to assess the extent of end organ damage. Once diagnosis has been established, electrocardiogram should be done in all newly diagnosed hypertensive patients to look for the early electrical changes associated with the hypertensive heart disease, such as left ventricular hypertrophy, left atrial enlargement, and concomitant heart disease, coronary artery disease, or arrhythmia. Besides, in ECG, the initial evaluation of a newly diagnosed hypertension should include a complete blood count. Yes, this should also be done. Fasting, serum glucose, lipid, TSH, serum electrolyte, renal function, and urine analysis. If ECG has abnormality, then the next step is go for echo. If the RFTs are abnormal, next step is go for ultrasound. If urinary is abnormal, next step is go for ultrasound abdomen, and if renal biopsy if indicated. So you have to go in a stepwise manner. But these are the basic investigation you should keep in your mind. You should keep in your mind regarding the hypertension. So if you are in your clinic and you see a patient and there is known case of hypertension, you check his record whether these things are done or not. If they are not done, so these must be done, and there should be monitoring for each and every patient regarding his chemistry and regarding the clinical situation of the patient. So you have to correlate both clinicals plus chemistry, clinical chemistry, and then the next part is the counseling of the patient. That is very much necessary regarding the dietary restriction, the exercise, the avoidance of salt, and cessation of smoking, the weight loss. So you have to keep all these things in mind. So this was a basic message. What investigation would you like to do in case of a newly diagnosed hypertension or already known case of hypertension? Thank you for watching.